Mental health disorders in teens have soared in recent years, and doctors say the COVID pandemic has only worsened things.
It's forced the American Academy of Pediatrics to declare national emergency in child and adolescent mental health. News 9's Robin Marsh has a few ways you can tell if your child is struggling. It's today's Medical Minute.
Teens in the U.S. are struggling when it comes to mental health.
At one point, she told me she was having suicidal thoughts.
If I die, then that pain will go away.
I want nobody ever feels to see what I saw, to feel this pain.
Today, 1 in 5 teens suffer from at least one mental health disorder. Studies show suicide rates have been increasing every year since 2007.
Suicide is the second leading cause of death for 10-year-olds to 34-year-olds.
There's new research suggesting a teen's mental health can affect their health on their heart later on in life. A study that looked at more than 20,000 people found that adults who were more optimistic as a teen were less likely to develop cardiovascular disease. So how can you recognize the sign of trouble in your teen?
I think a couple of the biggest signs that we see are when anyone starts to become really withdrawn and they don't want to participate in things they normally were excited about.
Other possible indicators include trouble sleeping, negative thoughts or actions, changes in appetite, anxiety, irritability, or a personality change. If you notice these issues in your children, do not try to immediately solve the problem.
We go into parent mode, we go into fix-it mode. We want to fix our kids no matter what's wrong with them.
Instead, listen to your child and encourage them to get professional help. It could spark a positive change that affects them for years to come. Some of the most common mental health disorders in teens are depression, anxiety, and even eating disorders. For today's Medical Minute, I'm Robin Marsh.